السلام عليكم. Good afternoon everyone. بيسعدني إنه أدير الجلسة الحوارية عن الابتكار في القطاع الصحي وكون مع مجموعة من القادة الملهمين في مجال مؤسساتهم وبلداتهم. When we talk about innovation in healthcare, it's not about technology. It's about saving lives and create systems that work for everyone. Innovation in healthcare, it's mandatory, especially healthcare. It's fast changing industry, so we need to innovate not only for ensuring the care it's advanced for everyone, but also accessible and efficient. And we will discuss with you more about how you use innovation in your organization to drive impactful change in your organization. And to start, I would love to ask each one of you to highlight and mention how you define innovation in the context of your organization, ecosystem, or your country. And if you can bring this into life by giving powerful example about initiative or a project from your organization. I would like to start with Dr. Kalthoom, as I work closely with EHS, and I'm always impressed with the innovation culture you have and the impact it has had here in UAE. So if you can start.
Thank you, Farah. Let me just start thanking the organizing, let's say, committee for this gathering. I'll name it gathering and connecting the brains and the innovators from different industries. And this is actually what we are looking for. The innovation within healthcare, it's how to transform the care delivery to our patient. Of course, in EHS, which is Emirate Health Services, the main goal is to put the patient in the center of the ecosystem of the service as a service provider. By using the technology, using science of data and prediction and all the advanced tools and technology, including AI, for better outcomes to our patient. And this is actually the ultimate goal, what we are looking for. Of course, and the main objectives is the better outcomes for the services provided to their health and enhancing the patient experience. So through the collective of the tools and technology and data which we have to improve the health of our patient. And this is the ultimate goal, and this is the simple definition of the innovation within EHS. Maybe later on I'll elaborate more on what are success projects which implemented and reach to the same objective which we put it as a mindset for the innovation implementation in EHS.
Next, we need to hear from you more about a lot of innovation projects you already have and implement, which has a huge impact on the patient care and quality of care as well. Yeah. So we will be back to this point. Dr. Mohammed, if you can share with us also from your organization, from Saudi Arabia, how you define innovation, and if you can give like a quick example about innovative project has impact on care and changing also the way of care for patients.
Thank you, Farah. Maybe I would love to start with the quotes of His Excellency, the Minister of Health, Mhandis Fahad Al-Jalajil, when he said, one of the main goal of the health transformation program is to build an ecosystem that is prioritize patient-centric approach, better digitalization of services, and definitely better transformation within the context in healthcare. Maybe just to cover the question specifically, one of the big, I think, success or examples of implementing technology is establishing the virtual hospital or Sahha virtual hospital. We are inspired by the story His Highness's Prince Mohammed when he launched the vision 2016. And one of the pillars falling below that vision is the healthcare and how we transform the healthcare to a different era. So now I think this is one of the very good example to help patients stay alive, which is providing healthcare services for those people who they cannot travel to your centers and they are living far away. This is one of the big examples we do have in our country. Yes.
Thank you so much for highlighting this. And as I start, like innovation in healthcare to make the care it's accessible, and it's a great example how this center helped the care to be accessible for all patients, even like across the borders. Thank you so much. I would like to hear from you how you define innovation in King Hussein Cancer Center, where it's needed the most, especially when it comes to cancer care, and also if you apply innovative project really had impact on their
Okay,
way
thank
of
you
care.
for this opportunity. So I think development of new medication is an innovation, but development of new strategy, development of even policy that improves the patient's quality of life and survival is an innovation. I think the main, at least based on my humble opinion, is making something that is applicable and sustainable, especially when you are talking about non-profit organization like King Hussein Cancer Center. An example for that is in 2016, we started a small project which was testing patients, breast cancer patients, for genetic testing for BRCA1 and BRCA2. People who born with these mutations have higher risk of developing breast cancer. So the benefit for patients who already diagnosed with breast cancer is you can also do some intervention or preventative measures to lower the chance of having another cancer or ovarian cancer, for instance. So it was just 100 patient in collaboration with MD Anderson and Leeds University in UK. After that, we take it to the next level, which is doing genetic testing, 84 genes, not 2 genes, for all patients diagnosed with solid tumors. Acceptance rate was amazing. Surprisingly, it was even higher than Canada, in where I did my training. More than 95% of patients just accept these genetic testing. After that, it became, we have right now well-established program, cancer genetic program. We reached 10,000 genetic testing last month, which is the hugest number in the region for a single institution. And we started to take it to the next level. One of the main benefit, and this is a privilege for our region, for instance, comparing between practicing cancer genetics in Jordan and in Canada, for instance, or Western countries, they have small family size, biological parents, the small families. So you can't offer cascade testing, which is testing for the family, or I mean the benefit of doing that is really limited. However, in Jordan, we found a great opportunity. You can just reach horizontal and vertical in family tree. You can reach 10 or even 100 first and second and third degree relatives. So you can do testing for them who are unaffected with cancer, offering them genetic testing. And from that, you can begin with having a huge number of unaffected with cancer, but have genetic testing, because almost 50% of them are going to have this mutation.
Thank you so much. And it's, of course, it's a game changer for everyone, because we always say healthcare, it's not only treating patient, it's preventing the sickness, and especially when it comes to cancer, like it has a huge impact for everyone not to have it, or to have like any way to go to facility for that. Thank you so much for highlighting this, and it's great also for collaboration with a lot of cancer and research center around the world. It will be attractive. So now we will talk about, when we talk about innovation in healthcare, we mentioned digital transformation. And I will start with Dr. Mohammad. If you can tell us how Saudi Arabia and your organization adopting advanced technologies like AI, Internet of Medical Things, data analytics to enhance patient care.
I think maybe we do have a lot of clinical examples. But if you allow me, Farah, to take your questions just to tailor it in my organization, because I'm working as a director of innovation and I'm working as a respiratory specialist. So I'm visiting and assessing patients in the daily basis. We found that especially nowadays, the population health centers or the PHCs are one of the main core business that each healthcare facility should empower it. So we were thinking about implementing some AI and digital solutions for those centers. Especially in our country, we are covering a geographical distance. So we are, for example, covering the north and the north and the east of the Riyadh region only as a cluster. And yeah, because from the population is extremely high, 3 million plus, I think. So how can we detect, for example, those people among the 3 millions whom they can have a high risk of diabetic through screening the eyes? So we are just asking patients to go to an AI-driven device inside the PHCs. The AI will analyze, will screen the eyes, will see the visuals. If there is some clinical analysis, then it will give us a prediction. Okay, you as a cluster or healthcare center, you have in this or in that region, there is a high risk for some patients, they will have some diabetic. So it's good to intervene earlier than late. And we talk such examples to a very simple way, such as the pediatric, the children whom they are suffering from or they are receiving the chemotherapy. And maybe Dr. Faris, he knows how painful for patient taking some chemotherapy or even the injection. So we think how we could make the journey of receiving the medication more friendly, more easy. And imagine that we just put them using the VR machine, showing some cartoons. It's very simple, but really it changed their experience. So the value, it really changed their experience. Maybe we do have a lot, but maybe I will just mention with you.
I see, and here where innovation it comes, like it helped, like as you mentioned, in adapting the technology and digital transformation to enhance patient experience and make it more, more good for and impactful. I will ask you about challenge, because adopting digital transformation, it has a lot of its challenge. Can you share like most significant challenge from your experience in adopting digital transformation and technology?
Actually, challenges which we faced in healthcare or in EHS specifically, at the same as it is in other industries. Resistance or adoption of these technology as tools to be implemented. So the change management was the tool which we use as a strategy in order to overcome resistance from an end user. And this is actually what I'm always, whenever I'm presenting about the technology, digitalization, or adoption of AI or new tools, the word will come that resistance from the end user because they don't want to change. It's not this actually. What we noticed that whenever you are involving an end user or a service provider from the beginning, from the day which you are planning or designing any of these tools to be implemented, so the adoption will be more and the resistance will be less. So Of course, it will be through involving them in the designing, or even from thinking about what could support them, because they are the service provider, and they are a bit aware more what are the needs for their customer. The second tool will be by upskilling their knowledge and their, let's say, information, how this technology or how this digital tools will help them to or ease their responsibility of providing the services. Because as a physician, and this is actually clear, and I think most of us as a physician, the ultimate goal which we are looking for is to provide the service easily to our patient, of course, with the best outcome which we are looking for. So involving them, upskilling them, empowering them with all the skills, all the information, all of the training which they are in need, I think less resistance will be there, and easily they will adopt any of these technology.
Thank you so much. And you're inspiring leader, because you mentioned the challenge and you talk about also strategy, how to overcome challenges in adopting technology. If you can add more from your side and experience about challenge and strategies to overcome challenge when you're adopting digital transformation and technology.
Okay, so first of all, I think the fragmentation of softwares that we use on daily basis in hospitals, for instance, for radiology, you may use software, another one for the medical records, different healthcare systems in the at the national level. There are many different softwares. So integration between all of these things make it really challenging. For instance, we started AI, some sort of AI for predictions, but this is what we are facing right now: how to integrate all of these different softwares, how to overcome that. Trying to unify the same softwares. Another thing, to use the same templates for some diseases, so that will make it easier to detect information. Privacy, this is really a big challenge in terms of digital, because always the data leak is a problem. We are not talking about the patient name and date of birth and few past medical history. We are talking about the family history, social history, DNA samples. So it is really complex. How to overcome that? We need more cybersecurity to be involved, in the healthcare system. Lastly, I will give you an example, which I have a permanent scar in my mind because of that. When I was in Canada, there was two hospitals, Princess Margaret and Sick Kids, University of Toronto hospitals. All of a sudden, there was a problem in the internet. In Sick Kids, it was ransom. Some hackers requested the money just to resume the service. So you are in front of your patient. You have no access to the medication, no access to the blood work. You can't proceed with any so it was really challenging. It was the definition of helplessness. So we have to protect we have to deal with it as a real problem. Like the code red, for instance, for fire, we have to have code X or Y for the IT problem, which will increase in the future, I think.
Thank you for highlighting this. And as all of you agree, like each challenge has solution ready to be found. That's why we innovate. And we are here also together. We're coming from different countries. Here in healthcare, we have United Arab Emirates, Saudi Arabia, Jordan. So it's great to even connect online and extend your experience and challenge you face and how you come together in solution work for everyone. My quick question, if you can, all of you, add, name which technology you believe that will be the most disruptive for healthcare in the upcoming 5 years. Just mention which technology.
Radiology.
All agree.
Biotech.
You can choose something else.
لازم نفسه ولا غير؟ لأنه أنا I think the biotech is really interesting, and even in our country, there is a drift and a strategic vision directly for the biotech field. It really could change the game.
Dr. Kalthoom.
For me, actually, I'll take genomic and the precision medicine. This is actually the future. It's like a concept of personalized treatment and management for each patient depending on their gene background. Of course, in UAE, as an UAE Genome Project, it's already launched in UAE by end of 2024, and from January 2025, it is mandatory within the premarital testing, the genome, let's say, test which will be there, and of course, couples will receive counseling whenever there is an issue for them if they will go for or they continue with the marriage. Of course, whenever you will open it for them, this will be at the end their choice, but it will reduce maybe in the morning. I don't know if you've been here. One of the audience, she mentioned about how it is challenging whenever you'll have a baby with let's say genetic disease. Of course, genetic by itself, it's like a concept, but what we need an AI in order to analyze all of these data, huge data which will be generated from them, and this is what we are implementing in UAE. So the other concept of new technology data and analytical data, how we are utilizing big data for the benefit and let's say positive outcomes for our patients. So precision medicine and genome will be the future.
If you allow me, Farah, to add what Dr. said, in 2021, in our country, we established the Authority of Research, Development and Innovation. And I think there is one statement have been mentioned in the previous panelists and discussions, which is it's very important to regulate and to determine the pathway where we want people to think and bring ideas and solutions. So it came from the management of our country, and they prioritize four things. The first and the top of the list is the صحة الإنسان, the health of well-being. So it's our priority to invest, to tackle, and belong that group. There is some subdivisions of some challenges and some pathways that we want to lead and take over. So people that dramatically will think and will bring ideas, solution. Not only this, even funding, sponsoring, everything will be covered for those who are gonna match those interested. So it's good to have that alignment between different countries.
And inspiring for other world. As I mentioned, it's the role for healthcare, it's preventing, and by applying and adopting this kind of technology, it's really helped to prevent and to keep hospital even like empty just for preventing the care. And the good things, because we have you in rooms, it's live, so I'm sure like it's really great insight from all of you, sharing a lot of innovative projects from your countries and organizations. So we have many attending us live because this one live. Innovation never happened in isolation. That's what we always say. And the teamwork is the innovation superpower. So Dr. Mohammed, if you can tell me in your organization how you enhance collaboration internally and externally with the academia, with the startups, with the private sectors as well, university, to accelerate innovation.
Well, I think maybe internally, the collaboration within the administration itself, it's really matters. And there is a statement have been mentioned by Doctora, which is about the change and resisting to change. I remember when I started one initiative, very small initiative 3 years ago, people get curious, why you add that guy with us? I'm telling them that he's a change officer. He's a change management officer, so we need him. Why? So we had a back and forth discussions. So I think this is one of of the problems. How to solve it? From my humble opinion, I think we established like innovation ambassador programs, which is targeting all people working in our clusters from different administration, different divisions, departments, clinical, non-clinical, everything. They are speaking about the diffusion of innovation curve, but maybe we want to see how we are going to diffuse the language of innovation within our more than 10,000 employees organization. Externally, maybe we are lucky that I'm not endorsing this, but I think we are close to have like an empowerment and building capabilities with Google, IBM and Huawei as an external bodies, and all of those collaboration for the sake to empower the AI capabilities, knowledge and skills within the cluster component and employees. This is maybe it came to my mind now.
Thank you so much. I always support the training because that's the key to start with.
Capabilities. Without people, we cannot
building
move.
capability. So invest more. Always we say in healthcare, training and innovation as well. And change is a chance that we always say. So it's good for everyone to have this mindset. When it comes to cancer center, I think the collaboration it's mandatory because you need to have access and collaboration with all research and development happening around the world with the universities, academia. So can you tell us
Yes,
more?
in fact, we have most of these collaborations. The challenge, of course, is funding, resources. Limited resources countries, you have some priorities. So although you have some sort of collaboration, but you can't do everything you dream to do. But at the end of the day, the motivation for innovation, and usually this is what the message we send for our sister hospitals in North America. Even they have to think about innovation in healthcare system in general. For instance, right now, the United States spend $4.9 trillion on healthcare system per year. Canada, they spend $300 billion on healthcare system per year, but the healthcare system is declining. Unfortunately, the main challenge there is they are not focusing on sustainable healthcare system. And right now they are facing the aging. Almost 20% of population in Canada are 65 and older, and half of the fund goes to this population. In 2040, it is expected 70% of the fund are going to this age group. So they have even to innovate for sustainability, which I think we have to think about this in our country because we are a young population. We are still, for instance, Jordan, median age of Jordanian population, 24 years. Canadian almost double this number. So half of people are really young. So we have to invest in, as you've mentioned, training. We are a young population, and we have to have strategic plans to prevent the future challenge, which even very rich countries cannot deal with it properly right now.
So much. And longevity. We need to increase the age also in our country. Dr. Kalthoom, I know in EHS you call the external partner your strategic partners, and you already, I know, like a lot of success story from collaborating with the different external partners. If you can share one success story from you enhancing collaboration, which help your organization in accelerate the innovation and support innovation.
Yeah, actually, just to stress and reinforce what was mentioned, that to change the mindset of the importance of innovation within the practice or the organization, you need to take it cross-sectional, because maybe to start with, whenever there was any discussion about the innovation, always they would refer to the innovation section or department, which is within the organization. But this is actually what we did. that innovation, it is the responsibility of everyone within the organization, and they are the one who should drive the innovation within the organization, and this is what, alhamdulillah, we succeeded on that. On the other hand, of course, as an organization, we can't succeed in any of these projects without, let's say, a collaboration and, let's say, a communication and even a mutual agreement and project to be implemented with our external strategic partner. Really, we are not looking for this organization as an external vendors. No, it's a strategic partner who will start the project, and we are taking it forward. Of course, we have, if we are talking about an internal institute, it's like Mohammed bin Zayed AI University. We have a collaboration with them in order to implement AI within the services provided, and also one of our partner within, which outsourcing radiology services through the Unison and GE. It's implementing AI within detection of breast cancer in a screening part. We have also with Siemens. We implement a project like a think tank, and we are taking it for a prototyping in one of local also institute, which is an innovation and testing center, which is there in Sharjah. So actually we have a lot of partnership. We have a lot of partners with within the EHS who are supporting the EHS to take any of these ideas, any of these projects to be implemented, and of course looking for better outcomes for the services provided to our patients.
Thank you so much, and it's really inspiring.
And let me not forget actually Ginny as a support for the innovation culture as a whole, and this is what we are looking forward. So it is not those, let's say, institutes or organizations who are mastering healthcare only. No, we need actually institutes mastering event or expert in the innovation as a concept to be implemented in EHS.
Thank you so much for investing in this and have this mindset and building, as I mentioned, the culture of innovation. We ran out of time. Before we close, thank you so much for dynamic discussion and all insightful, which is really inspiring for everyone when we talk about healthcare. Just I will highlight main takeaway from our discussion now, and then you can add also your final note. Innovation, it's not about tech, it's people, policies, and partnerships. When we have a challenge, here we welcome innovation, and every challenge has solution ready to be found. That's why we innovate. Finally, healthcare system, it's not what we build, it's how we collaborate and work together to enhance and serve the patient and the community. So if you would like to add also your final note, because we close the session.
I think you summarized everything I want to say.
Yes, sure. But
there are different schools, of thought. So I would suggest this treatment. I go to the doctor, they say, no, this treatment, and so forth. So I face this problem a million times, And when I want to choose a doctor, I find it so difficult. I'm talking the perspective of the patient now. It's very difficult to find the right doctor in a hospital or anywhere else. And every doctor has different opinion. So what, I mean, how to go about it? This is what I am facing all my life here. Thank you.
Okay, so this is a challenge that will never resolve. Why? Because we have to depend on evidence. There is a hierarchy of evidence, and usually most of the evidence that we have is low quality evidence. When you go up, you're gonna reach the high level evidence. High level evidence does not answer most of usual questions. So usually we have also to depend on lower quality evidence. And this is the goal of guidelines. So when we have guidelines, there's some sort of difference in guidelines between the Canadian, American, European, Jordanian guidelines based on many things, based on the accessibility for, if you have access for X or Y medication. So this is, there is no one solution, same answer for all of these things. So it is what it is. Yeah, it is what it is.
And yes, you can add, then I will add.
Yeah, I'll just state it general. I'll not go toward let's say the details or dig deep in that. Yes, there is different schools of practice, but believe me, whenever you are seeking any of help or support from a physician, or whatever the plan, they will discuss it with you. You are the one who will be the best to choose. And no one of these physicians is looking to harm the patient. Let's agree on that. This is actually the main role of the physician is to support the patient to get the best treatment and to have the best outcomes. There is different schools. Some schools will start aggressively if we are talking about, let's say, somehow like a cancer patient, to start aggressive and then to tailor it down. Some will tailor it slowly until they reach to the state. But believe me that even if any of these plans was discussed with the patient, it's for their benefit. And let's agree on that as a physician, we are here just to support the patient for the best management plan who will fit the patient, because he's the one in the center of this service.
And trust the system, the doctors, the physicians. You want Sure.
Thank you so much for the discussion. My question is, I'm a bit scared about the future, both for the patients and for the medical doctors. And I will cite an example. There is an app now that young pregnant women, some of them don't go to the hospital anymore. They pick the app and go through the app that will tell them 1 week, this is how your baby is, this is what is happening. So what is the future of medical doctors, or if all these technologies are implemented, the AI to monitor, tell the patterns of patients and the drugs that are going to take. So what are the future? Secondly, the technologies that are being imbibed now, are they being taught in school? Taught medical students in school, so that as they come out, they start practicing them, or they have to wait after graduating before learning the technologies to use?
If you allow me just to add a comment in the first part of the question, and maybe whoever said AI will eliminate physician, this is wrong, definitely. AI is there to empower some decisions, to make the journey, the experience of the beneficiaries much better. And I will take this context in my specialty, respiratory care. I am working in the intensive care units, dealing with the ventilators, machines, and etc. And we do everything manually. But I know that in the coming years, AI can do everything alone, based on the reading from the patients. So AI could analyze this patient has sick lung, this patient has good lung. So based on that and this, I will manipulate the numbers. So AI will be accurately on timely based, will do the best change in the mechanical ventilation. So this is just a simple example, and definitely in the different specialties they do have a lot. And I will leave the rest for my colleagues. I think we are run of the time.
We can discuss offline. You can add if you want. Go ahead. Sorry for.
Actually, it is maybe this is the concern of a lot of industries or the employees that AI is replacing jobs. It's not actually the AI who will replace you as an employee wherever your industry. It's the other employees who are empowered and skilled with the AI will replace you. So you should upskill yourself using the technology, using the AI, and accordingly, of course, you will stay because the AI, it's a tool. And it's need actually an input from a human being. And this is actually clear in the ChatGPT. Whenever you are the one who will write the prompt in order to get the answer. The second part, which I totally agree with you, that the curriculum of the medical school should empower and should change in order to prepare the new generation, new physician for upcoming, and this is what's happening. This is I'm sure and I'm 100% sure that it's there in UAE. So the curriculum of the medical school, it's toward implementing the technology and the concept of technology for the services and empowering the student of that.
And we can carry this offline. As I mentioned, we have now after that lunch, so you can discuss more because it never ends when we talk about healthcare. Thank you so much. Thank you for dynamic. Thank you so much for that. And thank you for Jenny, organizer as well. We have Mohammad, Anthony, Jida, everyone behind here. Thank you so much.